Have you ever wondered what happens during a consultation for braces? Well, in this video, we're going to talk about just that. We're also going to discuss a few things that you should watch out for when you're out there shopping around for orthodontic quotes. Stay tuned. Hey everybody, my name is Dr. Jesse McGuire. I'm the owner and orthodontist at ProSmiles Orthodontics in Goodyear, Arizona. Our goals with these videos are to educate, motivate, and initiate your journey to your best smile. We serve patients of all ages from 7 to 77, and we proudly serve the residents of Goodyear, Avondale, Litchfield Park, Surprise, and even Buckeye. We encourage you to comment and engage with other people in the community. We want to make sure to get as many questions as we can going. And also, go ahead and tag a friend that may be interested in hearing this talk, or someone that you know that may be looking forward to getting braces in the next few weeks and may want to know about what's going on during the initial consultation phase. Let's get right to it. So the very first thing, of course, after you book your appointment, you're going to get lots of paperwork, everybody's favorite part. So you're going to get quite a few things. You're going to get new patient paperwork. You'll also have health history, dental history forms, and insurance information. The new patient paperwork is basically to gather all the demographic information that we need about you. So this is going to be pretty basic stuff. Name, address, phone number, contact information like email, best way to contact you such as text and info like that. We're going to gather all that demographic information so we know who you are, where you're from, and also while you're watching this, let me know where you're from in the comments. That's one thing I forgot to ask last time, but I'm interested to see where everybody's watching from. So the second part, you're going to have health history, and the health history paperwork is basically gonna give us all the details that we need to know to make sure that you're in great health to treat, and also that we can treat you safely. And so this paperwork is gonna ask you questions such as allergies, allergies to latex, maybe nickel allergies, allergies to any medications that you're taking. There are some medications out there that can affect orthodontic treatment or affect the oral cavity, maybe cause like some swelling of the gums or extra growth of gum tissue. So we want to know those things from your medical history. Lastly, your dental history is going to give us a basic overview of your dental needs or the dentistry that you've had done. It's going to kind of give us an idea of your last checkup and some of the other things that you've had done. Maybe history of trauma. Maybe when you were 6, your sister punched you in the face and you lost your front tooth. Mom stuck it back in there. Those are actually really important things to know, so we kind of have an idea of where you've been and where we want to get you. That's going to be your medical history, dental history, and then the last bit of paperwork that you'll have is your insurance forms or dental insurance paperwork. And so this is going to allow our treatment coordinator to piece together the insurance puzzle to give you the best quote on your treatment fee and how your insurance benefits will go together with that. We also have patients that come in sometimes and they have dual insurance. So we want to make sure that we coordinate your insurance benefits very well. So once you finish up with that new patient paperwork, you're going to hand that over to our treatment coordinator, Dixie. Dixie's awesome at what she does. She is bubbly, has a great personality. She's going to get you into our consult room to get the actual consultation process started. So what Dixie's gonna do is she's gonna basically review all of the paperwork that you've handed over. So Dixie's gonna kind of find out why you're in the office, who sent you to the office, your history of orthodontic treatment and orthodontic care. And Dixie is gonna then pass that information on to me in what we call the doctor handoff. Now I'm coming into the consult room, and this is a very important moment. This is the moment that makes or breaks the orthodontic process in general. During dental school, we are taught to create small talk or initiate small talk with patients to kind of break the ice before we like jump in your mouth and take a look at what's going on. But I am a firm believer that there is no such thing as small talk. In this office, everything's big talk. And what I mean by that is the first like 30 seconds that we're engaging or I'm talking to a patient is super crucial. That's the time where I'm gonna build a rapport with myself and the patient, with myself and mom, myself and dad. And if you don't like me as a person, there's just no way that we're gonna mesh together under a professional patient-doctor relationship. And so that part of the initial consultation is extremely crucial to me to make sure that I put my best foot forward when we are sitting in that consult room, and this is the first time that I'm walking in and you're seeing me. So during my initial consultation, I'm gonna do a few things. I'm gonna evaluate your overall health. I'm gonna evaluate your dental situation. We complete the dental exam, and now I'm gonna piece together all of these pieces of information into a problem list, diagnosis, and a treatment plan. Treatment plan, the entire goal is to take care of all the things we find in your problem list. Most orthodontists, most dentists are incredibly smart individuals, and we have a great wealth of knowledge of really technical terms, dental terms, and things that we use to communicate with each other as colleagues and professionals. But sometimes for patients, we really need to simplify things. And so I tend to live by the KISS principle when we're in the office and I'm talking to a patient. And so what I do is I give a relatively simplified problem list and a very, very simplified treatment so we both can be on the same page with what's gonna happen. Occasionally, a case will come in or a patient will come in and they'll have a really difficult bite, or they'll be missing what looks like missing a tooth, or maybe have an impacted tooth. And so at that point, I'll ask or prescribe an x-ray to make sure that I get as much diagnostic information that I can before I give you a semi-finalized treatment plan. So we don't take x-rays on every single patient when they come in for their initial consultation. I only will expose a patient for an x-ray if absolutely necessary. And sometimes it is, sometimes it isn't. So when we do your initial records, we always take those x-rays and pictures and everything that we need to make sure we have the whole complement of ortho records. So we go through a simplified problem list and a treatment plan. So for example, mom, Sally, has really severe crowding on the top, moderate or mild crowding on the bottom, her bite's a little off, and so there's a problem list. To correct those problems, Sally's gonna need braces on the top and bottom. She's going to be in braces 18 to 24 months, and she's gonna need some rubber bands to fix her bite. On Sally's problem list may also be her hygiene isn't pristine. We need to improve her hygiene. So in our treatment plan, that will also follow. We're gonna be really tough on Sally to make sure she improves her oral hygiene through treatment, okay? So there's our problem list and now also our treatment plan. I'm also a big time proponent of staying in the consult as long as it takes. If you need me in the consultation for 35 minutes, I will stay in the consultation with you for 35 minutes to answer all of your questions. You take as long as you need to make sure that you understand the treatment that you're committing to and that the treatment that I'm gonna provide for you. So definitely ask as many questions as possible. Once we finish the questions, I then hand you right back over to our treatment coordinator, Dixie again. So Dixie's gonna come in and she's gonna complete the financial consultation part of the orthodontic consultation for braces. So Dixie's gonna summarize your treatment needs. She's gonna give you a quote for your treatment, a fee for your treatment, and she's also gonna show you what your insurance benefit is and how that impacts your treatment fee. So she'll give you, for example, if you have $1,000 that we expect to receive from your insurance, she'll include that $1,000 benefit in your fee and give you an absolutely accurate quote. She'll also break down with you how to pay for your ortho treatment, and whether it be in-house financing, third-party financing through like a care credit. Some patients like to pay for their treatment in full. Some patients like to use their HSA benefit. And so Dixie is amazing at breaking this down to help you pay for your treatment. Make sure you ask all the questions and you understand everything that's being put in front of you. She'll also break down your down payment requirements and your monthly payment requirements throughout your entire treatment, okay? So now, if everything looks good and you're ready to start treatment, we want to get everything signed, sealed, and delivered so we can get your braces on. So what you're gonna get, once you agree to your treatment, everything looks great, we're gonna give you a financial contract. And this is the time where you have to take another time, you wanna take as much time as possible to read through everything and make sure you understand what you're looking at, what you're agreeing to, and what you're signing. You're gonna have things such as a financial contract, a monthly payment schedule. You're also gonna have like a social media consent form, a consent to treat you just in general, office policies, financial policies, missed payment policies, those really important things. So take your time, read through those documents, and make sure you ask as many questions as you need to finish that up. So that's done, you're signed, sealed, and we're getting you back to get your braces on. We do same-day starts with patients. If they're ready, we are always available to do those starts the same day with you. And so that's pretty much the process of orthodontic consultation from start to finish, from coming in to getting your braces on. With that process, here's a few things that you should expect when you come into the office. The first is just the amount of time you're gonna be in the office. So between checking in, your paperwork, consent forms, you're gonna spend at least 35, 45 minutes in the office getting everything done, okay? That's your financial consultation, my consultation, or my exam, and the financial presentation. So that's gonna be at least 45 minutes. If you intend to start treatment that same day, you really wanna plan about an hour and a half out of your schedule to be in the office to get everything going. Sometimes we have patients come in, they have braces from another office, or they started 5 years ago, they come in, they want to get their braces off, put ours on, and get started with treatment again. You are going to want to put aside about 2 full hours from start to finish, because it's going to take some time to take those braces off, clean off all the remaining glue, and then rebond you with our brackets. So that's time-wise. The other thing that you want to do is you want to make sure you come prepared with what you need to have. So an ID, insurance card, and all the info that we need for your insurance to verify your insurance and coordinate your benefits. And then for down payment purposes, if you're gonna start the same day, cash, credit card, check, care credit, credit card. Those are a couple things to expect. That's pretty much it. Pretty basic, pretty simple, pretty easy, low stress, so you don't have to worry about stressing out, breaking a sweat when you come into the office. Now, let's talk about a few things that you want to watch out for or that you want to pay attention to when you're going and getting quotes from office to office. So the first thing is you want to make sure you understand what you're committing to, what your agreements are, and what you're paying for. And this kind of goes back to our second video, which was entitled How Much Braces Cost. So you want to make sure that you're confirming you're paying for your braces on, all your adjustments or activations, your retainers, your retainer checks, taking your braces off. You want to confirm that those things, your records, are a part of the treatment fee that you're going to pay for. And let me backtrack. I have to be completely honest. When I had the last video, I was so nervous that I forgot to tell you guys how much braces cost. And that was the title of the video. So I can't tell you exactly person to person, but I can give you the averages for our office. So the average time that a patient is in treatment at our office tends to fall between 14 to 18 or 18 to 24 months, about the average time in treatment. The average fee for treatment is about $4,500, okay? So obviously, because it's an average, there are cases that are a little bit less, there are cases that are a little bit more expensive. Those all average out to about $4,500. So 18 to 24 months, $4,500 is our average. That does not include your insurance benefit. That also doesn't include the $500 new patient special that we are running right now. I had to throw that in because I totally forgot to talk about it last time, even though the name of the video was How Much Braces Cost. So that's just a quick backtrack on how much braces are. So if I was able to provide you with some value and you liked our video, tap that like button, smash that wow face, because we really enjoy the feedback. We're gonna go ahead and wrap this video up today. As always, we look forward to having you in the office and to earn your business. All the information that you'll need to book or find out about our practice will be located in the top comment. Thank you guys again for joining us. For ProSmiles Orthodontics, I'm Dr. Jesse McGuire. We'll see you soon. Thank you guys.